Vaccination protects one from getting seriously ill and dying from COVID-19. After getting a vaccination, for the first 14 days, you do not have significant levels of protection. Then it increases gradually. For a single-dose vaccine, immunity will normally occur 2 weeks after vaccination. For 2-dose vaccines, both doses are considered necessary to achieve the highest level of immunity possible. Researchers are still investigating about the extent to which COVID-19 vaccines keeps you from being infected and transmitting the virus to others. The statistics surfacing from countries is indicating that the vaccines that are currently in use are protecting against severe disease and hospitalization. Still, no vaccine is 100% effective, and breakthrough infections are unfortunate, but could be expected. Variants of concern, and whether the vaccines provide protection against these strains, as the non-variant virus, are under research. While the COVID-19 waves have caused extensive devastation, there is also an increase in the number of people who got reinfected or contracted COVID-19, in spite of getting vaccinated. Numerous amongst them were the ones who had been partially vaccinated or had received both doses of the vaccine. In addition to this, the risk of reinfection and contracting the infection escalates twice for those who have weakened immunity or suffering from health conditions that make the vaccine less effective. It is also important to keep in mind that the infection risk reduces only when an individual has received both doses of the vaccine and immunity has developed. Apart from this, there are some mistakes a fully vaccinated individual must avoid to prevent the risk of contracting the infection. We will discuss a few of them with you. With the mutant virus still in full force, masks and following social distancing are still required. Getting the vaccine is only a preventive method to lower the chances of infection. As community-wide immunization will take time, it wouldn't be a wise idea to take the masks off yet. Especially if you are in a public place with people around, be concerned about keeping the masks still on. As masks have been proven to be much effective clinically, specialists now aggressively recommend people to wear double masks, that is, to layer a surgical mask over a cloth mask, for added protection and minimize infection risk. Ensuring correct measures involving social distancing and hand washing would also still be required. Although vaccines offer a considerable level of protection for a healthy immune system. However, some evidence has pinpointed that the currently approved vaccines may not be as effective for someone with poor immunity or frail health. Especially, some health conditions, including cancer and autoimmune conditions, could weaken vaccine efficacy rates and offer lesser protection. Immunocompromised people have a high risk level for COVID infection and severity. They should continue taking additional levels of precautions and limit their activities if they can. Specialists are presently also exploring the need for booster or additional doses, which could protect immunocompromised people or those with certain comorbidities. Also, restrictions have consequently eased up in numerous countries. However, the virus is still active. Hence, complacencies of any kind can cost highly if measures are not being taken, despite being vaccinated. Even if you have been vaccinated, consider the demographics of the event or the place you visit before making a decision. As per professional guidance, outdoor gatherings are still safer than indoor venues with less ventilation. Smaller gatherings with vaccinated people around are encouraging. In addition to this, traveling is something that you may need to be rethought of, particularly internationally. The Delta variant is now spreading rapidly to countries across the world, and there is a spike in the cases. Hence, precautionary travel and practicing safe measures are vital. Avoid traveling or go to high-risk places or containment areas with a history of spikes. If you need to quarantine, limit your movement in safe circles, and do not take any measures casually. Some studies have also indicated that women and people above the age of 55 cope with the highest dangers of illness. While you depend on the vaccine to do its job, uncontrolled, newer comorbidities, left unchecked, can also cause damage, so take care of your health. Efforts are in progress to reduce viral transmission and ramp up vaccine coverage. To help keep you and other people safe, you should continue to maintain at least a 1 meter distance from others. Cover a cough or sneeze in your elbow. Clean your hands frequently. Wear a mask, particularly in enclosed, crowded, or poorly ventilated spaces. And follow guidance from local authorities based on the situation and risk where you live. Take care.